Good morning, everyone. Today's topic is principles of radiation protection. Ionizing radiation can trigger two types of effects. They are deterministic and stochastic effects. These deterministic effects, they occur only above the threshold value of a dose. For stochastic effects, there is no any threshold value of a dose. Just remember this. So, aim is to prevent the deterministic effects. The dose limit value, because it has a threshold value of dose, the dose limit values are set so that the deterministic effects are ruled out. So for deterministic effects, there is a threshold value, like all these effects occurs only above the threshold value of a dose. So our aim is to prevent these effects. The dose limit values are set so that the deterministic effects are ruled out. So for stochastic effects, there is no threshold value of a dose. So to reduce the risk of stochastic effects to a reasonably achievable level, that is the aim. How do you do it? In order to keep the risk of stochastic damage as low as possible, three general principles have been set out in radiation protection for dealing with ionizing radiation. So for stochastic effects, they have kept three principles. What are they? Justification, dose limitation, and optimization. So each one will go through. So the first one is legal requirement for justification. So here what we'll do, so to prevent these are all principles to prevent stochastic effects. So for every new application of ionizing radiation or each new use of radioactive material by the man must be justified in advance. So whatever you are doing, that we have to write a letter so that they will justify it before you are using any new radioactive material, new use of an radioactive material, or new application of ionizing radiation. It must be justified in advance. So it also applies when, due to new activities, people are occupationally exposed to existing mostly natural radiation. For this also it applies. For example, at an increased level, mostly natural radiation at an increased level. For example, cosmic radiation during flights or radon in mines and waterworks. So for this, they will justify it whether it has to be used or not, whether the benefits are more than damage. So one is for every new application of ionizing radiation, each new use of radioactive material by man must be justified in advance. So first one is legal requirement justification. Here, for every new application of ionizing radiation or each new use of radioactive materials by man, it must be justified in advance. So for every new application of ionizing radiation and for every new use of radioactive material, before only you have to justify it. This also applies for the people who are occupationally exposed to existing mostly natural radiation at an increased level. For example, cosmic radiation during flights or radon in mines or waterworks. So the new activities are permitted only when they are associated with a reasonable benefit for the individual or society. If there is more benefit, the new activities are permitted then only. So reasonable means the benefit outweighs any health detriment possibly caused by the activity. Even if there is a damage, but the benefit outweighs it. So the existing activities are reviewed in case of significant new finding. If there is new finding, the existing activities are also reviewed. Normally in medicine, where ionizing radiation is used for diagnostic and therapeutic purposes, we speak of the justifying indication. So most justifying indication is when this radiation is used for diagnostic or therapeutic purpose. This is the justifying indication. The benefits and the possible damage cannot be determined objectively in each case. So it may not be easy sometimes to justify the new activities. So sometimes it's very difficult to justify it. So this is the legal requirement for justification. The second point is dose limitation. The legal requirement for dose limitation is the dose of radiation that people are subjected to during justified activities must not exceed certain limit. This is dose limitation. So the dose of radiation the people are subjected to that activities which are justified, the dose of the radiation for that people are subjected during justified activities, they must not exceed certain limit values. that is dose limitation. That limitation, dose limit values, they apply for general population. So it will be different for general population and persons occupationally exposed. Limit values for the population determines the maximum total radiation an individual person may receive from the justified activities. Limit values for certain exposure pathways, ingestion, inhalation, externally by ambient radiation, ensure that limit values for effective dose and for organ equivalent doses are strictly adhered to, and one exposure pathway does not determine the entire exposure. The limit values for person occupationally exposed to radiation, different limit values will be there for the whole body. Additionally, for body organs, different periods, month, year, career, different group of people, adolescent, adults, women of childbearing age and pregnant women. However, there are no limit values for medical radiation exposure for diagnostic or therapy. Here, justifying indication by the specialist doctor or legal requirement and the legal requirement for optimization apply. So next one is legal requirement for optimization. If an activity that is connected to radiation exposure and contamination is justified, a aforementioned principle of optimization requires that any unnecessary radiation exposure and contamination be avoided. So if any activity that is connected to radiation exposure and contamination is justified, okay, justified means something like benefit is more than the effects. Aforementioned principle of optimization and requires that any unnecessary radiation exposure and contamination be avoided. Optimization requires the likelihood of exposure, the number of exposed persons, the individual dose affecting a person, or kept as low as reasonably achievable. So we use the principle of ALARA, as low